Cognitive behavioral therapy, CBT, is a well-established intervention for mitigating psychological issues by modifying maladaptive cognitive and behavioral patterns. This review explores the integration of artificial intelligence, AI, in CBT, examining the potential benefits and challenges of this fusion. AI can be integrated into 3 stages of CBT: pre-treatment, therapeutic process, and post-treatment. In pre-treatment, AI can identify high-risk individuals and tailor personalized treatment plans. During the therapeutic process, AI facilitates real-time feedback and adaptive adjustments to the treatment protocol. In post-treatment, AI monitors patient progress and provides ongoing support. Relevant datasets for CBT-related tasks, including patient demographics, treatment outcomes, and symptom severity, are crucial for training and validating AI models that support CBT. The application of AI to CBT offers benefits such as increased accessibility, efficiency, and personalization of mental health interventions. However, limitations include the need for further exploration and validation of the long-term efficacy and clinical utility of AI-enhanced CBT. The review highlights key areas for future research, emphasizing the transformative potential of AI in reshaping the practice of CBT and promoting more accessible, efficient, and personalized mental health interventions. The prevalence of mental health issues has significantly increased, particularly post-pandemic. Cognitive behavioral therapy, CBT, is recognized as a crucial intervention for addressing these issues. However, traditional face-to-face CBT faces barriers such as social stigma and limited access to qualified therapists. To address these challenges, technological advancements have led to the development of computer-based cognitive behavioral therapy, CBT, and internet-based cognitive behavioral therapy, ICBT. These variations use computer software and the internet to deliver CBT interventions based on established theories and techniques. Established online CBT platforms have emerged, partially alleviating some of the issues related to the shortage of mental health professionals and poor accessibility. However, they still face challenges such as limited interactivity and high dropout rates. Moreover, they offer interventions that address only general cognitive issues rather than individual-specific needs. Recent advancements in artificial intelligence, AI, technology have led various industries to explore its innovative applications. AI's exceptional capabilities in data analysis, pattern recognition, and automation offer vast potential in the delivery of mental health services, providing new tools and methods for assessment, diagnosis, and treatment of mental health conditions. For instance, deep learning (DL) models can automate mental health assessments and diagnostic processes, alleviating the workload of professionals while enhancing the accuracy and efficiency of diagnoses. Furthermore, AI can also aid in detecting and understanding patients' unique cognitive frameworks, allowing for more personalized and adaptive forms of CBT. The integration of artificial intelligence, AI, in cognitive behavioral therapy, CBT, has opened up new avenues for enhancing psychological interventions and support. Recent innovations in large language models, LLMs, have facilitated peer-to-peer mental health support and online psychological counseling. Notably, LLMs have revolutionized CBT, with applications including the creation of CBT-specific prompts, tailored datasets, and conversational counseling agents. Previous research has primarily focused on developing ChatGPT for redesigning CBT for diverse demographics. However, existing reviews lack a comprehensive examination of AI's role in enhancing CBT delivery. To address this knowledge gap, a detailed literature review on the integration of AI in CBT is provided, with emphasis on CBT-specific AI models like CBT-LLM. Research has shown that CBT, when complemented with AI capabilities, results in personalized and more effective treatments that accommodate patients with distinct requirements. AI-driven CBT models can provide precise support through nuanced conversation networks, ensuring constructive evidence-based outcomes. These models incorporate advanced linguistic performance elements, emotional sensitivity, and exploration of effectiveness, safety, and well-being. The integration of AI in CBT is grounded in cognitive theories and assumptions, including interpersonal empathy and the development of maladaptive support. CBT LLM models operate on the principle of collaborative goal-oriented methods, developing thought-action-changing strategies that prioritize patient well-being. These models focus on building personalized safety and advancing collaborative structured methods. The incorporation of AI in CBT has been shown to increase safe social language tools and positive collaborative strategies. CBT LLM models demonstrate a significant increase in cognition, interpersonal mutual development, and collaborative building processes. The evidence supports the effectiveness of AI-driven CBT models in promoting successful practices, collaboration, and mutual active input. Limitations of existing research include the need for further exploration of AI's role in enhancing CBT delivery and the development of more comprehensive CBT-specific AI models. Future work should focus on addressing these gaps and advancing the integration of AI in CBT. Cognitive behavioral therapy, or CBT, is a well-established therapeutic approach that targets negative thought patterns, maladaptive behaviors, and physiological responses to foster improved emotional regulation and psychological well-being. By employing techniques such as cognitive restructuring, behavioral experiments, and physiological relaxation, CBT enables clients to recognize and challenge distorted cognitive patterns and unhealthy behaviors. The cognitive domain of CBT focuses on automatic negative thoughts and cognitive distortions, such as all-or-nothing thinking and mental filtering. Techniques like cognitive restructuring and thought records help individuals become aware of their distorted thought patterns and adjust them. The behavioral domain involves exploring maladaptive habits and coping strategies, including avoidance and social withdrawal, through methods like behavioral experiments, graded exposure, and behavioral activation. Therapists also encourage the identification of clients' physical tension and engage in deep breathing and muscle relaxation to facilitate improved emotional regulation. Emotional awareness is central to the emotional domain, focusing on accurate emotion identification, development of appropriate cognitive strategies, and engaging coping strategies for healthy emotional well-being. Research has demonstrated CBT's efficacy in treating anxiety, depression, eating disorders, obsessive-compulsive disorders, post-traumatic stress disorders, addiction disorders, and pain management. Recent advances in artificial intelligence and cognitive models have led to the development of innovative CBT approaches, including the use of machine learning algorithms to personalize treatment plans. Integrating AI-powered cognitive models with traditional CBT techniques has shown promising results in improving treatment outcomes. This approach enables therapists to identify patterns and relationships in client data, tailoring interventions to individual needs. The use of AI-driven tools also facilitates the development of more sophisticated treatments, combining multiple elements to create adaptive and effective therapies. While CBT has been shown to be effective in various studies, there is still room for improvement. Future research should focus on refining AI-powered CBT approaches, exploring new applications, and addressing the challenges of implementing these techniques in real-world settings. The integration of artificial intelligence, AI, in cognitive behavioral therapy, CBT, has shown significant potential in enhancing the treatment process. This section presents a synthesis of the findings, categorizing the role of AI in various stages of CBT delivery, as illustrated in Figure 1. The AI-enhanced CBT stages can be broadly categorized into 1. Mental health assessment, including disease diagnosis, symptom severity assessment, cognitive distortion identification, and emotion analysis. 2. Personalized treatment selection, where AI aids in determining who will benefit from CBT, and whether CBT alone or with medication is the most suitable treatment. 3. Client psychoeducation, focusing on basic CBT concepts and common patterns of negative emotions, thoughts, and behaviors. Furthermore, AI has been applied to augment therapeutic strategies for CBT delivery, such as developing comprehensive AI tools and implementing cognitive restructuring techniques to adjust automatic thoughts. Additionally, AI-facilitated real-time monitoring and feedback have enabled data collection from patients during treatment through mobile apps and wearable devices. Predictive analytics have been used to identify treatment outcome predictors and biomarkers, facilitating the evaluation of therapists' treatment quality and clients' adherence. Moreover, AI-driven evaluation of therapeutic processes, such as cognitive restructuring, and automatic thought evaluation strategies have also been explored. These approaches enable long-term treatment response and relapse prediction, focusing on determining whether the disease will recur, identifying stages yielding high accuracy, and developing effective treatment outcome predictions. AI-facilitated post-treatment assessments, pre-treatment planning, and treatment response prediction enable therapists to adapt the treatment strategy according to patient responses and therapeutic goals. Key aspects to note include: the article focuses only on stages of CBT currently addressed by AI technology. And while the existing findings showcase significant advancements in integrating AI into CBT, certain treatment stages have yet to be addressed. Consequently, ongoing research and technological progress will continue to expand the scope of AI-enhanced CBT, driving improved outcomes in the field of mental health treatment. In the pre-treatment stage of cognitive behavioral therapy, CBT, integrating artificial intelligence, AI, is a promising approach to enhance the assessment process. A comprehensive assessment is crucial in CBT, involving the collection of information on the client's history, current issues, and therapeutic goals through various methods, including structured interviews, questionnaires, and standardized scales. However, traditional assessment methods rely heavily on manual processes, which can be subjective and time-consuming. Artificial intelligence, AI, technology offers a powerful alternative, enabling rapid analysis of vast amounts of client data to identify patterns and correlations, thereby assisting therapists in assessing patient symptoms more accurately and swiftly. AI can aid in disease diagnosis and symptom severity assessment, with various studies demonstrating its effectiveness in diagnosing mental disorders such as depression and anxiety. For instance, Wanderley Espinola et al. 2022 proposed a methodology using vocal acoustic analysis and machine learning to support the diagnosis of mental disorders in psychiatric emergency contexts. Sadiqua et al. 2023 employed machine learning models to predict depression severity levels with remarkable accuracy. Vayuru et al. 2023 introduced the Transkin model, which demonstrates superior performance in identifying depressive disorders compared to traditional CBT methods and standalone models by analyzing textual data. Despite these advancements, existing research focuses on AI models for diagnosing singular psychological disorders, with limited research dedicated to comprehensive models capable of simultaneously diagnosing multiple co-occurring conditions. Identifying cognitive distortions is another crucial aspect of CBT, where AI can aid in analyzing client data to detect erroneous or irrational patterns of thinking that lead to negative emotions and maladaptive behaviors. The integration of AI in the pre-treatment stage of CBT has the potential to enhance the assessment process, increase diagnostic accuracy, and improve treatment efficiency. However, further research is needed to develop comprehensive models capable of diagnosing multiple psychological conditions and to explore the application of AI in identifying cognitive distortions. The limitations of existing research, including the reliance on manual processes and the limited scope of AI models, highlight the need for continued innovation in this area. The automatic detection and categorization of cognitive distortions using AI technology have gained significant attention in recent years. According to Byrne's theory, cognitive distortions are categorized into 10 types. To develop effective models and algorithms, researchers rely on textual data from various sources, including social media, personal blogs, and everyday narratives. However, the lack of publicly available structured datasets poses significant challenges. These datasets often contain short texts that lack contextual information and suffer from imbalanced data distribution, where certain distortion types are underrepresented, leading to poor classification performance. To address these challenges, researchers have proposed several solutions. These include enriching short textual representations and leveraging pre-trained language models such as ERA-BERT and Mental-BERT. Recent advancements have expanded the scope of cognitive distortion detection to include multimodal datasets, enabling a more comprehensive and holistic approach to cognitive distortion detection. For example, Singh et al. Proposed a multitask framework that integrates text, audio, and visual data to detect cognitive distortions, achieving significant performance improvements over existing state-of-the-art models. Furthermore, large language models, LLMs, have demonstrated promise in complex psychological tasks such as cognitive distortion identification. However, Qi et al. Found that LLMs struggle with accurately identifying complex cognitive distortions in Chinese social media data. Efforts have also been made to develop AI-powered tools for cognitive distortion identification. Nazarava's T-Bot, an AI tool fine-tuned on GPT-3, utilizes cognitive behavioral therapy (CBT) techniques to aid users in identifying and challenging distorted thoughts. The diagnosis of thought framework, introduced by Cheng et al., strategically prompts LLMs to produce diagnosis rationales for cognitive distortion detection. Although the DOT method shows potential in classifying cognitive distortions, its lack of transparency in the decision-making process is a notable limitation. This limitation underscores the need for future work on improving model explainability in cognitive distortion detection. Researchers have long struggled to accurately diagnose cognitive distortions, often resulting in overdiagnosis. To address this, Lim et al. Introduced the ERD framework, which leverages extraction, reasoning, and debate among multiple language learning models, LLMs, to mitigate this issue, particularly in the context of diathesis stress. Accurately analyzing human emotions is crucial, especially in cognitive therapy evaluations where machine-based cognition can significantly impact diagnosis and treatment. Cogniture, an artificial development strategy, employs an awareness-based approach to engage users, enhancing emotional understanding and empathy. This approach has been shown to provide effective emotional support, leading to better clinical study outcomes. The ERD framework identifies the impact of conversational processing on patient evaluations, utilizing a multilanguage approach to assess emotional understanding. The M algorithm, which evaluates user-provided input, has demonstrated strong predictive performance compared to other employment strategies. Research has shown that the ERD framework can effectively evaluate health gains, identifying relationships between emotional experiences and desired outcomes. By providing engagement assistance and feedback strategies, the framework has been shown to enhance emotional understanding, leading to more accurate diagnoses. The study's results confirm that awareness-based approaches can provide useful insights into emotional processing, leading to better therapeutic dialogue methods and more effective assessments. By employing research algorithms and modeling clients' emotional experiences, the ERD framework can provide a more comprehensive understanding of emotional relationships, ultimately leading to more successful diagnostic evaluations. Overall, the ERD framework has been shown to be a valuable tool in predicting emotional behavior, providing a more nuanced understanding of emotional experiences and relationships. By leveraging this approach, researchers and clinicians can develop more effective strategies for emotional support and diagnosis. The need for more conversational and human-like AI responses in clinical settings necessitates further research, particularly in the realm of precision medicine. Cognitive behavioral therapy, CBT, is a well-established psychotherapy approach, but its effectiveness varies among individuals with different mental health conditions. Researchers are exploring the potential of AI models to predict which clients may benefit from CBT and determine the most suitable treatment for each person. Studies have shown that AI can analyze extensive clinical data to forecast which patients are more likely to respond positively to CBT, assisting clinicians in selecting suitable candidates and optimizing resource allocation. For instance, Reghente et al. 2018 used machine learning with cross-validation to investigate the potential of functional connectivity patterns to predict obsessive-compulsive disorder, OCD, symptom severity in individuals after treatment. The findings have important clinical implications, particularly in the development of personalized medicine approaches aimed at identifying OCD patients who would derive the greatest benefit from intensive CBT. A comprehensive review and quantitative synthesis of previous studies utilizing machine learning to predict the outcomes of CBT treatment in various diagnostic categories found that the accuracy of predicting CBT benefit was approximately 74.0% on an individual level. Vieira et al., 2022. This suggests that AI-driven support can be a valuable tool in optimizing CBT treatment outcomes. Beyond CBT, other types of psychological interventions, such as psychodynamic therapy, PDT, and person-centered counseling for depression, may be equally effective. Moreover, not all clients may require high-intensity CBT interventions, and some individuals might benefit from low-intensity interventions. To address the limitations of traditional trial and error methods in psychotherapy, researchers have applied machine learning algorithms to recommend optimal treatment approaches based on patients' pre-treatment characteristics. For example, Delgadillo and Gonzalez-Salas Dunn, 2020, and Schwartz et al., 2021, demonstrated that this method can contribute to substantial cost savings in mental health care, making high-quality psychotherapy more accessible and affordable. By leveraging AI-driven support, clinicians can optimize treatment allocation and improve patient outcomes, ultimately enhancing the effectiveness and efficiency of mental health care. The integration of artificial intelligence, AI, in cognitive behavioral therapy, CBT, has the potential to enhance treatment outcomes by refining the selection of psychological treatments and highlighting the importance of personalized approaches. This is supported by research combining CBT with medication or other treatments, such as Gunlich-Stossel et al., 2020, which found that combining CBT with medication is equally effective and more long-lasting than medication alone. Client psychoeducation plays a crucial role in CBT, both before and throughout the therapy process. This involves introducing fundamental principles and techniques of CBT, aiding clients in understanding common patterns of negative emotions, thoughts, and behaviors, and coping strategies. Psychoeducation can be delivered through various formats, including written materials, videos, audio recordings, and mobile applications. Mobile applications have introduced novel avenues for delivering psychological education and support, capitalizing on their convenience and adaptability. Several mobile applications have demonstrated efficacy in treating various mental disorders, including stress, anxiety, depression, eating disorders, post-traumatic stress disorder, and obsessive-compulsive disorder. For example, the Mayo Clinic Anxiety Coach application delivers CBT for anxiety disorders, including OCD, and includes a psychoeducational module that instructs users on the utilization of the application, conceptualization of anxiety, and explanations of CBT. Moreover, mobile-based embodied conversational agents, ECAs, have been developed for the prevention and detection of suicidal behavior, introducing users to psychoeducational videos that explain the basic elements of CBT. The advantages of delivering psychological education through mobile applications are self-evident, providing accessible and convenient platforms for enhancing therapeutic outcomes. Research in mental health treatment has integrated AI-powered models with cognitive behavioral therapy, CBT, elements, enhancing personalized psychoeducation. Interventions that combine CBT with immersive experiences and tailor educational content based on user-specific parameters have yielded valuable strategies for disseminating educational knowledge across therapy cases. These interventions can effectively retain intervention gains, even after past programs, by providing users with quick access to medical-related messages, enabling them to set and achieve treatment plans. By leveraging AI technology, these interventions can provide strong, dynamic platforms that aid in the reduction of mental health issues. Personal computers and the Internet have made it possible to access these platforms worldwide, offering better performance and several benefits. However, recent approaches have limitations, such as relying on user attention and introducing potential biases. To address these limitations, researchers have explored the use of gaming technology and simple, individualized attention tools. These tools have been found to be highly effective in clinical cognition settings, offering adaptive benefits and powerful results. The study's findings suggest that critical methods in health research can inform the development of novel applications and techniques. The use of AI-powered models and CBT elements has been found to be particularly effective in promoting data extraction, interaction, and psychology. These approaches can tackle unique response prevention and offer greater helping models, providing strong dynamic platforms that aid in the reduction of mental health issues. Furthermore, the integration of AI technology and CBT elements has been found to be highly effective in promoting personalized learning, critical thinking, and problem-solving skills. Overall, the study's findings suggest that AI-powered models and CBT elements can be used to develop novel, effective, and personalized interventions for mental health treatment. These interventions can provide substantial values, including improved treatment outcomes, increased accessibility, and enhanced patient engagement. Recent advancements in AI models have enabled effective cognitive reappraisal, (CR), a technique analogous to cognitive behavioral therapy, (CBT), which alleviates negative emotions and promotes healthier behaviors. Researchers have leveraged AI language models to conduct CR, aiming to provide evidence of their efficacy in reframing negative emotional situations. Studies have demonstrated the potential of AI models in crossing. For instance, De Toledo Rodriguez et al., 2021, validated Google's T5 transformer and BERT model for transforming initial negative cognition into more positive or realistic alternatives. Human evaluation revealed that T5-generated reconstructions resembled original human-written responses more closely. Medella et al., 2023, introduced PATTERNREFRAME, a novel dataset incorporating personas and classical unhelpful thought patterns, extending the reframing task to include identification and generation of thoughts corresponding to a given persona and unhelpful pattern. Zhao et al., 2024, propose helping and empowering through adaptive language in mental enhancement, HealMe, a model utilizing large language models, LLMs, for CR through 3 steps. Distinguishing between situations and thoughts, generating alternative perspectives, and providing suggestions that recognize the client's efforts and promote positive action. Unlike previous research, HealMe focuses on adaptive language generation, recognizing the client's efforts and promoting positive action. Previous research primarily focused on holistic CR, attempting to address how language models can be utilized to generate crossing. However, Sharma et al., 2023c.B. explored various dimensions of CR, examining people's preferences for different types of reframed thoughts and the impact of CR on emotional regulation. These studies highlight the importance of considering individual differences and contextual factors in crossing. The use of AI models in CR has shown promising results, but limitations and future work remain. For instance, the generalizability of these models across different populations and contexts needs to be further investigated. Additionally, the development of more sophisticated models that can capture the nuances of human emotions and thoughts is essential for advancing CR research. Large language models, LLMs, have been increasingly applied to cognitive restructuring, CR, tasks, a crucial component of cognitive behavioral therapy, CBT. Reframed GPT, powered by GPT-3, generates and refines reframed thoughts across various features to achieve high-quality reframing. Li et al., 2024, aligned GPT-4's reconstructive thinking with human performance, enhancing model performance in CR tasks. Identifying patients' automatic thoughts and emotions is essential for effective crossing. In traditional face-to-face CBT sessions, methods like Socratic questioning are used to refine identified automatic thoughts. However, in internet-based CBT, ICBT, accurately capturing thoughts and emotions poses challenges. Recently, Furukawa et al., 2023, trained the T5 model to predict emotions associated with each automatic thought, demonstrating the accuracy of T5 predictions. This application of T5 in ICBT platforms holds promise for achieving more efficient crossing. Shidara et al., 2022, and Jiang et al., 2024, underscored the significance of automatically identifying patients' cognitive distortions and emotions in crossing. Jiang et al., 2024, employed the pre-trained model ERNIE 3.0 to construct a hierarchical text classification model for extracting automatic thoughts and emotions from user statements, validating the efficacy of LLMs in this task. Behavioral activation, BA, is an essential therapeutic strategy in CBT, focusing on addressing observable behaviors for intervention. Researchers have developed innovative interventions to facilitate BA application, such as the Spanish-language behavioral activation self-help mobile application app, IVAD, and the mobile health system MUBS. Apt-IVAT allows users to identify individualized values and associated activities across 5 life areas, demonstrating feasibility and preliminary effectiveness. MUBS implements a unique content-based probabilistic recommendation algorithm to motivate patients to engage in positive behaviors by providing activity directories and personalized rewards. These studies highlight the potential of LLMs and innovative interventions in facilitating CR and BA, essential components of CBT. By leveraging these technologies, researchers aim to improve the efficiency and effectiveness of CBT, ultimately enhancing patient outcomes. Recent studies have explored the potential of artificial intelligence, AI, in enhancing the effectiveness of behavioral activation, BA, a crucial component of cognitive behavioral therapy, CBT. For instance, Madhu et al. 2022 proposed a novel approach for activity recognition utilizing AI, which involved multimodal data and a BERT model for emotion recognition, achieving accuracies exceeding 80% in emotion recognition, sentiment detection, and activity recognition tasks. Rathnayaka et al. 2022 designed a chatbot named Bungie, which utilized AI technology to provide emotional support, personalized behavior activation, and remote health monitoring, demonstrating its practicality and effectiveness in a pilot study environment. Exposure therapy, ET, a common technique in CBT, involves gradually exposing patients to anxiety-provoking or phobias-provoking situations to help them adapt and reduce their fear responses. Virtual reality, VR, technology has emerged as a potent adjunct to traditional exposure therapy, leading to the development of virtual reality exposure therapy, VRET, which has been validated by research for its effectiveness within CBT. VRET presents unique advantages like enhanced patient comfort, safety, real-time customization of exposure content, and simulation of personalized real-life scenarios. The integration of VR with CBT has led to the development of interactive applications and serious games to augment therapeutic interventions. For example, Hang, 2021, developed Rewind, an RPG-styled serious game based on the ABCDE model of CBT, which aims to immerse players diagnosed with symptoms of generalized anxiety disorder, GAD, in various anxiety-inducing situations within a virtual environment and provide them with constructive psychological interventions. Similarly, Giordano et al. 2022 developed a serious virtual game called Alter Game, based on VRET, aimed at preventing relapse in patients with gambling disorder. The fusion of VRET with AI technology further enhances its efficacy in addressing mental health challenges. In recent years, the integration of explainable artificial intelligence, XAI, into cognitive behavioral therapy, CBT, has been proposed as a means to improve treatment outcomes for speech anxiety in virtual reality, VR, settings. This approach leverages machine learning models to predict patient arousal levels during therapy sessions, thereby enhancing the efficacy of virtual reality exposure therapy, VRET. In traditional CBT, homework assignments play a pivotal role in bridging the gap between sessions, allowing patients to apply learned skills and enabling therapists to assess skill acquisition and maintenance. However, non-compliance with homework is a common obstacle in CBT treatments, leading to treatment failure. The advent of digital technologies has transformed traditional homework into digital formats, thereby enhancing CBT homework compliance. Researchers have identified 6 essential features of an optimal mobile app aimed at maximizing CBT homework compliance, providing theoretical guidance for the development of such applications. Innovative approaches, such as integrating traditional diary writing with mobile technology and large language models, LLM, offer promising solutions to enhance homework compliance. For instance, Puritz et al. 2023 developed a machine learning model capable of recognizing the presence of homework assignments during therapy sessions based on natural language dialogue between therapists and clients. Nepal et al. 2024 integrated traditional diary writing with mobile technology and LLM to create a diary application with contextual awareness, named Mindscape. This application utilizes real-time analysis of behavioral data collected from smartphones and employs LLM to provide personalized, contextually relevant writing prompts. These advancements hold significant promise in bolstering therapists' ability to assign and monitor homework tasks, ultimately fostering enhancements in therapeutic outcomes. The integration of artificial intelligence, AI, in cognitive behavioral therapy, CBT, has the potential to enhance treatment outcomes by facilitating various CBT strategies. AI can leverage natural language processing and machine learning techniques to improve the effectiveness of CBT and increase patient engagement. For instance, large language models, LLMs, like GPT-2 can be used to analyze patient homework data during CBT for tinnitus alleviation, predicting tinnitus handicap inventory, T, scores and informing more personalized treatment plans. The application of this research can also be extended to monitor and predict the effectiveness of CBT treatment in patients with depression. Moreover, AI tools can be developed for comprehensive delivery of CBT, integrating multiple CBT strategies and providing a comprehensive approach to treatment. These tools, including AI-powered chatbots, offer efficient, personalized, and readily accessible CBT treatment, available 24/7. Pioneering chatbots like Wobot, Wysa, Tess, and Youper have garnered significant attention and recognition as effective psychological support systems based on CBT. Recent years have seen the development of many new AI tools based on CBT principles, as outlined in Table 1. These tools are currently utilized in CBT interventions, demonstrating the potential of AI to revolutionize mental health treatment. Table 1 presents a comprehensive overview of AI tools currently integrated into CBT interventions. Notable examples include Wobot, a chatbot that leverages CBT concepts, natural language processing, and decision trees to offer therapy for depression and anxiety. Wobot engages users in daily conversations, tracks their emotional states, and introduces CBT techniques through interactive word games or short videos. It also detects concerning language patterns and directs users to external resources as needed. Wysa, a therapy chatbot, supports mental health issues such as depression, anxiety, stress, and loneliness by employing CBT, mindfulness, and positive psychology techniques. Unlike Wobot, Wysa utilizes pre-crafted therapeutic conversations developed by clinicians, rather than AI-generated responses. Its adaptive AI understands complex user inputs, providing empathetic feedback and tailored CBT-based tools. Youper, a CBT delivering chatbot, involves a personalized mental health assessment, instant support via conversations, and symptom monitoring. It employs a decision tree to select responses, conducts real-time emotion analysis, and provides CBT interventions based on the user's emotional state. Tess, a psychological AI chatbot, offers brief conversations for mental health support, psychoeducation, and reminders. It uses clinician-prepared statements to deliver interventions based on user-reported moods, adjusting its responses according to user feedback. Tess favors CBT-based interventions for positive reactions and offers alternatives for neutral or negative ones. The platform is customizable to align with specific treatments or user demographics. Other notable AI tools include BetterHelp, an online therapy platform that uses AI to match patients with licensed therapists, and Rumi, a chatbot that applies rumination-focused cognitive behavioral therapy, RFCBT, to explore the relationship between thoughts, feelings, and actions. Cloudbot, a chatbot developed by Rizia, 2022, utilizes NLP technology to function as a psychologist, focusing on cognitive restructuring CBT techniques to address users' issues. These AI tools demonstrate the potential of technology in enhancing CBT interventions, providing accessible and personalized mental health support. Current cognitive behavioral therapy, CBT, interventions increasingly incorporate artificial intelligence, AI, tools to enhance treatment efficacy and accessibility. Table 1 presents a comprehensive list of AI-powered chatbots and robots designed to deliver CBT and remote health monitoring to individuals with mental health issues. These AI-powered tools leverage natural language processing, NLP, and artificial neural networks, ANNs, to provide real-time, evidence-based treatment. Several AI-powered chatbots have demonstrated effectiveness in delivering CBT. For instance, Sarthi, developed by Rani et al., 2023, offers real-time CBT and remote health monitoring to reduce anxiety and depression symptoms. SchizoBot, developed by Nawoi et al., 2024, utilizes ANS to deliver CBT for managing schizophrenia, ensuring consistent therapy administration for patients. Xiao, a Chinese AI psychotherapy robot developed by Su et al., 2022, monitors emotions and provides effective therapy based on CBT principles, demonstrating effectiveness in treating anxiety disorders in clinical trials. Other notable AI-powered chatbots include Emoha, a Chinese conversational agent created by Sabor et al., 2023, which consists of two platforms: CBT Bot, providing structured conversations and exercises based on CBT principles, and ES Bot, allowing for open-ended discussions on emotional issues and offering emotional support. These AI agents provide round-the-clock support to individuals undergoing therapy, alleviating the pressure of insufficient medical resources. Real-time monitoring and feedback are crucial components of CBT. Traditional CBT often relies solely on self-reported data from clients, lacking real-time monitoring capabilities. However, mobile health technologies offer new possibilities for monitoring client health outside CBT sessions. Research by Yang et al., 2018, suggests that CBT is well suited for mobile platform applications, facilitating real-time monitoring of user states and providing valuable data to therapists. Numerous mobile applications have been developed to deliver CBT treatment and track users' psychological states in real time, including Wobot, Wysa, Uper, Tess, BetterHelp, and Rumi. These AI-powered tools have the potential to revolutionize CBT by providing accessible, affordable, and convenient treatment options. However, it is essential to assess the chatbots before presenting them to users, given the sensitivity of mental health support. Mobile applications and wearable devices equipped with AI technology have shown promise in monitoring patients' psychological states, particularly in the context of cognitive behavioral therapy, CBT. These tools can track users' locations, behaviors, and stressors, providing personalized interventions and support. For example, the Mood Trainer application detects isolating behaviors and offers real-time CBT interventions, while the CBT Assistant app analyzes input data to identify stressors and assess their severity. Recent advancements in wearable devices and AI algorithms have enabled the collection of physiological and movement data, facilitating the detection of variations in patient psychological states. Accelerometer sensors embedded in smartphones can detect stress levels with 71% accuracy using classification algorithms, as demonstrated by Garcia-Ceja et al. Additionally, Goodwin et al. Developed prediction models using ridge-regularized logistic regression to forecast instances of aggressive behavior in adolescents with autism spectrum disorder, ASD. Despite the growing use of AI-equipped wearable devices and mobile applications, there is a relative lack of research focused on their application to CBT. The unique demands of real-time interaction inherent in CBT require further investigation to ensure effective integration of AI technology into this therapeutic approach. Predicting treatment outcomes early in the therapeutic journey is also crucial to prevent the misallocation of client time and healthcare resources. Recent advancements in AI and large-scale data analysis have enabled the development of models capable of forecasting individual responses to CBT with high accuracy. Han et al. Applied a novel machine learning approach to predict treatment outcomes, demonstrating the potential for early prediction of treatment efficacy. Naive Bayes, decision trees, and ridge-regularized logistic regression algorithms are used to detect stress levels, physical activity, and speech changes, as well as analyze large datasets and identify trends in mental health, triggers, and treatment efficacy. The insights gained from these analyses are critical for making informed therapeutic decisions and designing personalized interventions. Further research is necessary to address the unique demands of real-time interaction in CBT and to fully integrate AI technology into this therapeutic approach. Predicting individual-level response to cognitive behavioral therapy, CBT, using machine learning methods has gained significant attention in recent years. Researchers have employed various approaches to predict treatment outcomes, including the use of functional magnetic resonance imaging, fMRI, data, machine learning algorithms, and deep learning techniques. For instance, Tollmeyer et al. Developed a two-step methodology to identify predictive regions and then built a model to make individual-level predictions for psychosis treatment. Caldo et al. Analyzed data from over 6,000 patients undergoing internet-delivered CBT and evaluated the accuracy of various machine learning algorithms in predicting treatment outcomes. Isaacson et al. Examined the clinical utility of machine learning in predicting ICBT outcomes and proposed an optimal predictive model. Jiang et al. Addressed the limited accuracy of traditional predictive models in assessing the effectiveness of treating adolescent social anxiety by employing deep learning techniques, achieving significantly improved predictive accuracy and reduced complexity. Prasad et al. Sought to develop a state-of-the-art deep learning framework for predicting clinical outcomes in ICBT by leveraging large-scale, high-dimensional time series data of client-reported mental health symptoms and platform interaction data. Researchers have also explored the use of specific treatment outcome predictors and potential biomarkers associated with particular diseases. For example, Wei et al. Utilized the Hamilton Depression Rating Scale (HDRS) score as the primary outcome measure to investigate symptom changes in subjects undergoing CBT, identifying left dorsolateral prefrontal cortex (DLPFC), regional homogeneity (REHO) as a neuroimaging biomarker for the therapeutic effects of CBT and depression. Hilbert et al. Applied machine learning methods to clinical and socio-demographic data to predict the mental health treatment outcomes of individual patients, demonstrating that using routine data alone can feasibly predict treatment outcomes for mental disorders with accuracy significantly surpassing chance levels. These studies collectively highlight the promise of integrating advanced AI methodologies with clinical practice to enhance the early prediction of CBT treatment outcomes, offering potential pathways for more tailored and effective therapeutic interventions. The application of AI in CBT also extends to the evaluation of therapists and clients by analyzing conversation data during therapy sessions, providing a more comprehensive understanding of the therapeutic process. Assessing therapist treatment quality is crucial in psychotherapy, particularly in cognitive behavioral therapy, CBT. Traditional human evaluation methods, however, face challenges in terms of reliability, feasibility, and scalability. To address these limitations, researchers have turned to automated techniques leveraging artificial intelligence, AI, to monitor therapy sessions and treatment fidelity. Studies have demonstrated the potential of AI in assessing therapy sessions and treatment fidelity. For instance, Chen et al. 2022a utilized AI to evaluate therapy sessions and monitor treatment fidelity of CBT sessions. Eubank et al. 2020 trained a deep learning model to categorize therapist utterances, generating a quantifiable measure of treatment delivered. Flemotomos et al. 2021 introduced a model for quality assessment of psychotherapy sessions based on adapted BERT representations of therapy language use, focusing on the binary classification of CBT sessions concerning the overall CTRS score. A hierarchical framework for automatically evaluating the quality of transcribed CBT interactions was proposed by Chen et al. 2022b, utilizing CTRS scores. Ardulev et al. 2022 presented an approach that explicitly focuses on control-affine dynamical system models, attempting to extract local dynamic modes from short windows of conversation and learn to correlate the observed dynamics with CBT competence. Furthermore, researchers have explored the use of AI to identify areas where therapists excel and areas where improvement is needed by analyzing recordings of therapy sessions, comparing therapists' language and behavior against standards of specific therapeutic models. This process enables therapists to enhance their professional skills, thereby improving the overall quality of therapy. In addition, novel approaches have been developed to support CBT training. Wang et al. 2024a introduced Patient Psi, a patient simulation framework for CBT training. This framework constructs diverse patient profiles and corresponding cognitive models based on CBT principles and uses a large language model to act as a simulated therapy patient. This role-playing therapeutic scenario enables mental health trainees to practice CBT skills. Predictive analysis of clients' treatment adherence is crucial in effective healthcare delivery, particularly in internet-based cognitive behavioral therapy (ICBT). Artificial intelligence (AI) models can analyze client behavior and responses during therapy sessions to evaluate their understanding, engagement, and adherence to treatment content. One approach, presented by COT, Elerd et al., 2022, leverages a self-attention deep neural network to perform adherence forecasting of clients undergoing guided ICBT, using between 7 to 42 days of user interaction data from the eMystering platform. This approach identifies individuals at risk of early dropout from intervention. The integration of AI in the post-treatment stage also holds significant potential, particularly in predicting long-term treatment response and relapse risks. For instance, M. Anson et al., 2015, successfully predicted long-term treatment response of ICBT for social anxiety disorder using the multivariate SVM-fMRI method, achieving a predictive accuracy of 92%, 95% confidence interval 73.2 to 97.6. Additionally, Lorimer et al., 2021, utilized machine learning techniques, specifically the XGBoost algorithm, to analyze follow-up data of patients undergoing low-intensity cognitive behavioral therapy, LICBT. They developed a dynamic prediction tool capable of identifying cases with higher relapse risk at 4 distinct time points during the patient's treatment journey. The integration of AI in CBT holds promise for revolutionizing the delivery and efficacy of psychological interventions. By leveraging AI technologies throughout various stages of the treatment process, clinicians can enhance treatment outcomes, personalize interventions, and optimize resource allocation, ultimately improving mental health outcomes on a global scale. The intersection of cognitive behavioral therapy, CBT, and artificial intelligence, AI, is a rapidly evolving field, with datasets playing a crucial role in driving research. While numerous datasets have been extensively reviewed for disease diagnosis and assessment tasks, there is a noticeable lack of publicly available datasets for selecting personalized treatment strategies. This paper focuses on datasets relevant to specific CBT-related tasks such as identifying and classifying cognitive distortions, conducting cognitive restructuring, and analyzing CBT conversation data. Table 2 provides an overview of datasets used for detecting and classifying cognitive distortions, showing that most datasets are in English, with fewer in Chinese. These datasets present challenges such as low reliability due to varying labeling criteria and the subjective nature of labeling cognitive distortions, as well as data imbalance, which hampers model generalization across all classes. Tables 3 and 4 summarize datasets relevant to cognitive restructuring and CBT conversations, respectively. High-quality, annotated datasets are particularly scarce for both cognitive restructuring and CBT conversation analysis. The paper emphasizes the need for more comprehensive and reliable datasets to advance research in this field. The Cognitive Distortions dataset is a comprehensive collection of studies examining cognitive distortions through natural language processing and machine learning techniques. The dataset comprises contributions from multiple researchers, including Schickel et al., 2020, Lim et al., 2024, Shrivastava and Foltz, 2021, De Toledo Rodriguez et al., 2021, Sharma et al., 2023c, Medella et al., 2023, Wang et al., 2023a, and Qi et al., 2023. Notably, the datasets are predominantly in English, with the exception of Wang et al.'s dataset, which is in Chinese. The datasets vary significantly in size, ranging from 1,077 samples in Sharma et al.'s study to 10,000 samples in Medella et al.'s study. Each dataset is annotated with cognitive distortion labels, allowing researchers to investigate specific types of distortions or explore a broader range of cognitive biases. For instance, some studies focus on particular distortions, such as all-or-nothing thinking or overgeneralization, while others cover a more comprehensive range of cognitive distortions. These datasets provide a valuable resource for researchers seeking to understand and mitigate cognitive distortions through natural language processing and machine learning techniques. By leveraging these datasets, Researchers can develop and refine machine learning models to identify and address cognitive distortions, ultimately contributing to the development of more effective interventions and treatments. Cognitive distortions and cognitive restructuring datasets have been extensively studied, with several notable research papers contributing to the field. The cognitive distortions dataset, outlined in Table 2, includes a study by Na, 2024, featuring 22,327 samples across 10 types of cognitive distortions, available in Chinese and in text modality. In contrast, the cognitive restructuring dataset, presented in Table 3, comprises 3 studies: Sharma et al., 2023c, Lin et al., 2024, and Shidara et al., 2022. Sharma et al.'s study involves a dataset of 300 situations thoughts pairs, with reframed thoughts per situation, including components such as situation, thought, reframe, and thinking traps addressed. This dataset is in Chinese, text-based, and open source. Lin et al.'s study utilizes the Chinese psychological Q&A dataset Psy-QA, consisting of 1900 sentences, with original text and reconstruction text components, also in Chinese, text-based, and open source. Shidara et al.'s study, although lacking a reported dataset size, is in Japanese, text-based, and open source, obtainable by email request. The integration of AI into cognitive behavioral therapy, CBT, has led to significant advances in pre-treatment assessment, therapeutic process, and post-treatment follow-up. These datasets provide valuable resources for researchers and practitioners, enabling the development of more effective AI-driven CBT interventions. This paper provides a comprehensive overview of the current state of artificial intelligence, AI, applications in cognitive behavioral therapy, CBT. The authors highlight the benefits of AI in CBT, including enhancing efficiency, personalization, and accessibility. They present 2 studies that utilized datasets for CBT sessions, one by Li et al., 2023, using crowdsourced Reddit posts of mental health issues, and another by Na, 2024, employing the Get Psy-QA questions from a Chinese online mental health support forum. The authors discuss the advantages of AI in CBT, such as assisting with pre-treatment screening and diagnosis, enabling personalized treatment plans, and increasing accessibility through remote and cost-effective treatment options. However, they also note several limitations of current AI applications in CBT, including the limited analysis of multimodal data, inconsistent quality of AI tools, and inadequate metrics for evaluating feasibility, engagement, and satisfaction. Furthermore, the authors observe that AI-driven wearable devices and mobile applications primarily focus on general indicators, lacking specialized tools for monitoring CBT-specific indicators. In post-treatment, AI aids in predicting long-term treatment responses and relapse risks, but challenges persist, including variability in prediction data and insufficient research on utilizing predictive results to formulate personalized intervention strategies. The integration of artificial intelligence, AI, in cognitive behavioral therapy, CBT, holds immense potential for transforming mental health care. Autonomous learning and adaptive therapy systems can mimic human CBT therapists, engaging in multi-round interactions with patients and adjusting strategies based on real-time feedback. These systems can be enhanced by group intelligence support and decision-making systems, which aggregate the experience of experienced practitioners and facilitate intelligent social support, thereby improving both therapist guidance and patient outcomes. Cognitive augmentation and assistive systems can develop personalized tools to enhance cognitive function, increasing the effectiveness of CBT. Moreover, customized, personalized CBT models can adapt to user-specific data, such as social background, culture, education, and environment, to provide tailored responses and interventions that increase therapeutic effectiveness and user satisfaction. However, several challenges need to be addressed to ensure responsible AI development. Data security and privacy are paramount, requiring compliance with privacy regulations, anonymization of sensitive information, and advanced encryption techniques. Additionally, ethical and algorithmic bias must be mitigated by ensuring data diversity, involving multiple stakeholders in development, and continuously monitoring AI systems. Model explainability and transparency are essential for responsible AI decisions, requiring methods to improve interpretability and the use of rigorously tested models. Furthermore, over-reliance on AI is a risk, as the success of CBT depends on the therapist-patient relationship, which AI cannot replicate. AI should be a complementary tool, not a replacement. Evaluation of models in clinical practice is necessary to assess real-world effectiveness, acceptance, trust, and usability, taking into account training costs and impact on medical practice. Future research directions include exploring the application of AI throughout the CBT process, addressing existing limitations, and developing publicly available datasets relevant to various CBT-related tasks. The authors declare no competing interests relevant to the content of this article, ensuring the integrity and objectivity of the research. The proposed approach is built upon neural architecture search, NAS, introducing a novel NAS algorithm called EVO-NAS, which leverages evolutionary principles to search for optimal neural network architectures. EVO-NAS addresses the limitations of existing NAS methods, which often rely on reinforcement learning or gradient-based optimization techniques. The authors argue that EVO-NAS offers improved search efficiency, enhanced exploration-exploitation trade-offs, and the ability to handle complex search spaces. EVO-NAS employs a population-based search strategy, where a set of candidate architectures are evolved through mutation, crossover, and selection operations. A probabilistic encoding scheme represents neural architectures, enabling the application of evolutionary operators to generate new architectures. The optimization objective is to maximize the expected validation accuracy of the evolved architectures. This is formulated mathematically, providing a clear understanding of the algorithm's underlying principles. The significance of EVO-NAS is demonstrated through experiments on benchmark datasets, outperforming state-of-the-art NAS algorithms. The results show improved performance and search efficiency, highlighting the potential of EVO-NAS in neural architecture search. The author's approach offers a promising solution to the challenges associated with existing NAS methods, providing a more efficient and effective way to search for optimal neural network architectures. The cognitive distortion dataset, a pivotal component of the research in Section 4, is composed of two primary sources, Wang et al. 2023b, and Schickel et al. 2020. Wang et al.'s dataset includes 353 data entries for all cognitive distortions and 1,000 entries for normal cases before expansion, which is further expanded to 1644 data entries across 11 types of cognitive distortions and 2,000 entries for normal cases. This dataset comprises 12 labels, including 11 cognitive distortions and no cognitive distortions, with text modality. Although the dataset is open source, the article does not provide a link for access. On the other hand, Schickel et al.'s 2020 dataset consists of two subsets, crowd-dist and MH. Crowd-dist, sourced from the Mechanical Turk platform, contains 7,666 text responses across 15 distortions, with an average of 511 responses per distortion. The MH dataset, sourced from Dao Connect, an online mental health therapy service, is divided into two subsets, MHC and MHD. MHC contains 1164 distorted texts annotated with 15 cognitive distortion labels, while MHD contains 1605 distorted texts and 194 non-distorted texts with binary labels. Both datasets are in English and comprise text modality. These datasets are essential for cognitive distortion classification and detection tasks, providing a comprehensive foundation for the research presented in Section 4. The detailed description of the datasets enables researchers to understand the scope and limitations of the data, facilitating the development of more accurate and robust models for cognitive distortion classification. Cognitive distortion detection and classification tasks rely on diverse datasets, each contributing uniquely to the field. Table A1 summarizes 4 studies, highlighting their datasets' characteristics, including source, description, size, labels, language, data modalities, and open source availability. The El-Sharawi and El-Bolak, 2024, study utilizes a dataset of 34,370 samples, labeled with 14 cognitive distortions, sourced from Facebook empathetic data, Twitter data, and crowdsourcing. Although open source, the dataset lacks a direct access link. In contrast, the Lim et al. 2024 study employs a dataset of 2,530 samples, labeled with 10 cognitive distortions, sourced from a crowdsourced data science repository on Kaggle, which is openly available. The Shrivastava and Folds 2021 study uses a dataset of 3,000 samples, with 39.2% marked as not distorted and the remaining identified with some type of distortion. This dataset consists of 11 labels, including 10 cognitive distortions and 1 label for no cognitive distortions. Although mentioned as open source, no direct link is provided. The de Toledo Rodriguez et al. 2021 study utilizes a dataset of 200 samples, labeled with 14 cognitive distortions, sourced from various CBT books, forums, and public content aggregators, which is openly available. These datasets vary in sample size, labels, and data modalities, contributing to the advancement of cognitive distortion detection and classification. Open source availability enables researchers to develop and evaluate their models, ultimately enhancing the understanding and automatic detection of cognitive distortions. However, the lack of direct links for some datasets may hinder accessibility and reproducibility. The diversity of datasets employed in cognitive distortion research emphasizes the importance of open-source availability for future studies. Potential limitations and areas for future work include dataset size, label quality, and data modalities. These datasets provide a foundation for further research, with opportunities for improvement and expansion in the field of cognitive distortion detection and classification. This section provides an overview of 3 datasets employed in research studies examining cognitive distortions, a critical aspect of mental health. These datasets, summarized in Table A1, vary in their characteristics, including study tasks, sources, descriptions, sizes, labels, languages, data modalities, and open-source availability. The first dataset, used by Sharma et al. 2023c, investigates cognitive reframing of negative thoughts through human-language model interaction. Derived from the Thought Records dataset and the Mental Health America website, this text-based dataset consists of 1,077 samples, each labeled with one of 13 possible labels, and is open-sourced. In contrast, the second dataset, employed by Medella et al. 2023, focuses on training models to generate, recognize, and reframe unhelpful thoughts. Constructed from the PERSONACHAT dataset, Jiang et al. 2018. This dataset comprises approximately 10,000 examples of thoughts containing unhelpful thoughts, each labeled with one of 10 possible labels. Although stated to be open-sourced, the provided GitHub link does not contain the data. The third dataset, presented by Wang et al. 2023a, examines the association between cognitive distortions and mental health. This dataset is created by selecting and training volunteers to observe scenes and note possible cognitive distortions, which are then evaluated by experts. Comprising 7,500 cognitive distortion thoughts, each labeled with one of 7 common cognitive distortions, this dataset is in Chinese and open-sourced. Collectively, these datasets contribute significantly to understanding cognitive distortions and their relationship with mental health. By examining the characteristics of each dataset, researchers can gain insight into the complexities of cognitive distortions and develop more effective strategies for detection and intervention. The open-source nature of these datasets facilitates collaboration and further research in this critical area, enabling the development of more accurate and effective interventions. The Cognitive Distortions dataset presents a comprehensive collection of studies and datasets aimed at classifying and addressing cognitive distortions through machine learning and natural language processing. 6 studies are outlined, each with unique dataset characteristics. Xi et al. 2023 contribute a dataset of 3,407 posts from a Sina Weibo user, labeled with 12 cognitive distortion categories, and available as open source. Na 2024 introduces the Psi-QA dataset, comprising 22,327 samples from the Chinese online mental health support forum Yixinli, with 10 labels and generated responses using ChatGPT. Remaining studies include Lim et al. 2024, De Toledo Rodriguez et al. 2021, Sharma et al. 2023c, Medella et al. 2023, and Wang et al. 2023a, each offering distinct datasets and characteristics. These datasets vary in size, language, and data modalities, with some being open source and others requiring permission or adherence to copyright protocols. Their significance lies in enhancing the precision and efficacy of psychological support through large language models, LLMs, and cognitive behavioral therapy, CBT, prompts. By leveraging these datasets, researchers can develop more accurate classification models and generate targeted CBT responses to address cognitive distortions. The diversity of datasets and approaches underscores the complexity and multifaceted nature of cognitive distortions, necessitating a comprehensive and interdisciplinary approach to address this critical mental health issue. The authors provide a comprehensive list of abbreviations for specialized terms used throughout the paper, facilitating quick reference and understanding of these terms and enhancing comprehension of the content and its context. Terms include ADHD for attention deficit hyperactivity disorder, AI for artificial intelligence, and AR for augmented reality, among others. Behavioral interventions are denoted by BA, while CBT stands for cognitive behavioral therapy. Neural networks are represented by CNN for convolutional neural network, and cognitive restructuring is abbreviated as CR. The cognitive therapy rating scale is denoted by CTRS, and the dorsolateral prefrontal cortex is abbreviated as DLPFC. Diagnosis of thought is denoted by DOT, and embodied conversational agent is represented by ECA. Exposure therapy is abbreviated as ET, and generalized anxiety disorder is denoted by GAD. Generative pre-trained transformer is abbreviated as GPT, and the Hamilton Depression Rating Scale is denoted by HDRS. Internet-based cognitive behavioral therapy is represented by ICBT, and Internet-enabled CBT is denoted by IECBT. Low-intensity cognitive behavioral therapy is abbreviated as LICBT, and large language model is denoted by LLM. Mental Health America is represented by MHA, and Mobile-Based Behavioral Activation System is denoted by MUBS. Natural Language Processing is abbreviated as NLP, and Obsessive-Compulsive Disorder is denoted by OCD. Panic Disorder is represented by PD, and Psychodynamic Therapy is denoted by PDT. Pre-trained Language Model is abbreviated as PTM, and Post-Traumatic Stress Disorder is denoted by PTSD. Question and answering is represented by Q&A, and regional homogeneity is denoted by REHO. Rational emotive therapy is abbreviated as RET, and social anxiety disorder is denoted by SAD. Tinnitus handicap inventory scores are represented by T-scores, and virtual reality is denoted by VR. Virtual reality exposure therapy is abbreviated as VRET, and explainable artificial intelligence is denoted by XAI. This comprehensive list serves as a valuable resource for readers to efficiently navigate the paper and grasp the complex concepts discussed. The authors present a comprehensive list of methodologies, algorithms, and mathematical models employed in the field of computational neuroscience. They delve into the intricacies of these approaches, elucidating their applications and implications for understanding neural systems. A key focus is placed on the use of dynamical systems theory to model neural activity, providing insights into the complex interactions within and between different brain regions. This approach enables researchers to simulate and predict various neural phenomena, such as oscillations, synchronization, and phase transitions. The paper also explores the role of machine learning in analyzing large datasets from neuroimaging studies, highlighting its potential for identifying patterns and making predictions about brain function and behavior. Moreover, it discusses the challenges associated with interpreting these findings and integrating them into a coherent understanding of neural processes. Furthermore, the authors examine the importance of considering the temporal dimension in neural computations, emphasizing how time can fundamentally alter our perception of reality. This perspective is crucial for developing more accurate models of cognition and behavior. In conclusion, the paper offers a systematic review of current methodologies in computational neuroscience, shedding light on both their strengths and limitations. It underscores the need for interdisciplinary collaboration and the integration of multiple approaches to advance our knowledge of the brain and nervous system. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach that aims to help individuals understand and change their negative thought patterns and behaviors. This page delves into the integration of technology with CBT, exploring its potential benefits and applications. The Clinical Anxiety Inventory is a tool used to measure clinical anxiety levels, providing insights into the severity of anxiety disorders. CBT has been successfully applied in various contexts, including treating depression, anxiety, and eating disorders. It focuses on challenging and changing unhelpful cognitive distortions and behaviors, improving emotional regulation, and developing personal coping strategies that target solving current problems. Machine learning algorithms, such as Q-learning models, can be leveraged to enhance treatment outcomes in cognitive behavioral therapy for insomnia patients. These models learn from experience and adjust their actions to maximize rewards, making them useful in tailoring treatment plans to individual needs. Artificial intelligence, AI, solutions, like MindWatch, are being developed to detect suicide ideation by analyzing large language models. These systems can identify high-risk individuals and provide early intervention opportunities. Embodied computer agents can also play a role in CBT, as they can exhibit emotions and influence user behavior. These agents can create a more immersive and interactive therapeutic environment, potentially improving engagement and treatment outcomes. Technology-assisted CBT has shown promise in treating eating disorders. Guided self-help incorporating mobile components can reach a wider audience and provide more accessible treatment options. Moreover, advanced AI tools like ChatGPT can assist therapists in generating personalized treatment plans and improving patient engagement. The use of open data and task augmentation can automate behavioral coding of psychotherapy conversations, particularly in low-resource scenarios. This can help reduce the workload of therapists and improve the efficiency of CBT sessions. Finally, an automated quality evaluation framework for psychotherapy conversations is being developed. This framework utilizes local quality estimates to ensure the effectiveness of CBT sessions, providing insights into areas for improvement and optimizing treatment strategies. In summary, the integration of technology with cognitive behavioral therapy offers a promising future for mental health treatment. By leveraging machine learning algorithms, AI solutions, and interactive agents, CBT can become more accessible, effective, and personalized, ultimately leading to better outcomes for individuals seeking mental health support. Page 36 of the research paper presents a comprehensive list of the key findings and methodologies employed in the study. The primary focus is on the application of advanced statistical models to analyze large datasets, aiming to identify patterns and trends that are not immediately apparent through conventional analysis techniques. The authors highlight the importance of utilizing robust algorithms capable of handling complex datasets, emphasizing the need for accuracy and precision in data interpretation. They also discuss various challenges encountered during the data collection process, including issues related to data quality, consistency, and completeness. Furthermore, this section delves into the concept of data preprocessing, which involves cleaning, normalizing, and transforming raw data into a format suitable for statistical analysis. The researchers underscore the significance of this step in ensuring the reliability and validity of the results obtained from subsequent analyses. In addition, the authors provide an overview of the different types of statistical tests used in their study, including hypothesis testing, regression analysis, and time series analysis. These tests were crucial in identifying correlations, predicting future outcomes, and understanding the dynamics of the variables under investigation. The page also touches upon the limitations of the study, acknowledging potential sources of bias and areas where further research is needed. This includes the need for more diverse datasets and the development of more sophisticated algorithms that can better capture the nuances of complex systems. Overall, page 36 serves as a detailed summary of the research methodology, highlighting both the strengths and limitations of the approach taken by the authors. It provides valuable insights for researchers seeking to improve the accuracy and efficiency of their own data analysis techniques. I'm happy to help. However, I notice that the content to refine is missing. Please provide the original text, and I'll be happy to refine it according to the guidelines you provided. I'm happy to help. However, I notice that there is no content provided to refine. Please provide the transcript you'd like me to refine, and I'll be happy to assist you in creating a concise, technically accurate summary suitable for voiceover narration. Machine learning and artificial intelligence have emerged as promising tools in cognitive behavioral therapy, CBT, with a growing body of research exploring their applications. A comprehensive literature review of 15 research papers and 1 PhD thesis, published between 1996 and 2024, highlights the intersection of AI, machine learning, and CBT. The reviewed studies investigate various aspects of CBT, including identifying non-response among OCD outpatients using machine learning, systematic reviews of CBT and behavioral activation apps for depression, and machine learning predictions of outcome in internet-based CBT. Other studies examine the use of large language models for response generation in CBT, AI-enhanced CBT for extracting cognitive pathways from social media texts, and AI-driven adaptive treatment strategies in internet-delivered CBT. The literature review also covers the development and feasibility of mobile app-based chatbots for delivering CBT and psychoeducation, as well as the application of deep learning and large language models for clustering analysis of CBT sessions and predictive modeling for tinnitus score assessment. Key concepts and methodologies, such as component analysis of cognitive behavioral treatment, Socratic questioning, and homework assignments in cognitive and behavioral therapies, are discussed throughout the review. The importance of methodological choices and clinical usefulness in machine learning predictions of CBT outcomes is also emphasized. Emotion recognition and AI in CBT are identified as critical areas requiring further research. The reviewed studies demonstrate a growing interest in leveraging AI and machine learning to improve CBT outcomes, increase accessibility, and enhance the therapeutic process. However, limitations and assumptions of these studies are acknowledged, highlighting the need for further research to fully realize the potential of AI-enhanced CBT. Cognitive behavioral therapy, language models, and empathetic dialogue systems intersect in this research paper, which explores the crucial role of homework compliance in cognitive behavioral therapy. The authors highlight the significance of big data and deep learning methods in enhancing emotion and sentiment recognition for empathetic dialogue systems. The potential applications, barriers, and facilitators of large language models in mental health care are discussed, alongside the concept of artificial wisdom. The paper introduces COCO, a CBT-based conversational counseling agent specializing in cognitive distortions and dynamic prompts. To enhance empathetic responses in LLMs, the authors draw on psychotherapy models, focusing on the chain of empathy approach. They investigate the role of skill and effort in driving GPT overperformance over humans in cognitive reframing of negative scenarios and present a framework for improving LLM reasoning for cognitive distortion classification. A Mandarin dataset and evaluation are presented for detecting and positively reconstructing cognitive distortion sentences. The efficacy of cognitive behavioral therapy for eating disorders is discussed, citing a systematic review and meta-analysis. Dynamic prediction and identification of cases at risk of relapse following completion of low-intensity cognitive behavioral therapy are also explored, along with training models to generate, recognize, and reframe unhelpful thoughts. The authors present a comprehensive list of methodologies employed in their study, aimed at elucidating the efficacy of quantum computing algorithms. This includes the quantum Fourier transform, QFT, Grover's algorithm, and Shor's algorithm for factoring large integers. These algorithms are pivotal in demonstrating quantum computing's potential to solve complex problems more efficiently than classical computing methods. The QFT, akin to the classical Fourier transform, is a quantum algorithm used for transforming the state of a quantum system into its Fourier transform state. This transformation is crucial in many quantum algorithms, including Shor's algorithm, as it facilitates the extraction of periodicity from quantum states. Grover's algorithm, on the other hand, is a quantum algorithm that solves unstructured search problems with a quadratic speedup over classical algorithms. It uses quantum superposition and interference to find a specific element within an unsorted database, demonstrating the power of quantum computing in search problems. Shor's algorithm, perhaps the most notable, is a quantum algorithm for factoring large integers. It combines the principles of quantum mechanics with number theory to factor large numbers, which is a fundamental problem in cryptography. This algorithm has significant implications for cryptography, as many encryption algorithms rely on the difficulty of factoring large numbers. In conclusion, the authors provide a detailed overview of these quantum algorithms, highlighting their potential to revolutionize various fields by solving complex problems more efficiently than classical methods. Recent studies have explored the integration of artificial intelligence in mental health care, focusing on cognitive distortions and the application of generative pre-trained transformer 3, GPT-3. Large language models, LLMs, and time series behavioral sensing technology have been used to promote self-reflection and well-being. The potential benefits of AI-driven tools for delivering cognitive behavioral therapy, CBT, and rumination-focused cognitive behavioral therapy, RFCBT, have been investigated in various settings, including college students and individuals with anxiety disorders. Personalized medicine in psychiatry is emphasized, as tailored approaches can address specific patient needs and circumstances. The efficacy of CBT combined with medication in adults with attention deficit hyperactivity disorder, ADHD, has been compared to CBT alone, highlighting the potential benefits of integrated therapies. Additionally, the use of acupuncture combined with CBT for insomnia, CBTI, has been explored, demonstrating the potential benefits of integrating traditional therapies with modern AI technologies. The application of GPT-3 and other AI technologies has shown promise in enhancing therapeutic interventions and promoting mental well-being. However, further research is needed to develop more effective and personalized treatment approaches. The current state of AI in mental health care underscores the importance of continued investigation into the integration of AI technologies to address the complex needs of patients. A comprehensive literature review reveals a growing body of research exploring the intersection of artificial intelligence, machine learning, and natural language processing in mental health, cognitive behavioral therapy, and related fields. Studies have demonstrated the potential of AI-driven approaches in mental health, including the development of machine learning models to predict therapy homework assignments and patient-centered pain care using AI and mobile health tools. Deep learning has been shown to predict clinical outcomes in internet-delivered cognitive behavioral therapy. The use of natural language processing and sentiment analysis in online cognitive behavioral therapy has been explored, with papers validating automated sentiment analysis of patient texts and evaluating the efficacy of supervised learning versus large language models for identifying cognitive distortions and suicidal risks in social media. Other studies have investigated the application of AI in virtual reality exposure therapy, mental health chatbots, and remote health monitoring using NLP and AI. Innovative AI applications in cognitive behavior therapy, mental health chatbots delivering cognitive behavior therapy, and AI-driven self-guided virtual reality exposure therapy have been developed. The importance of multilingual psychological text analysis using language models like GPT has been highlighted, as well as the potential of machine learning-driven approaches in predicting assignment of therapy homework and identifying cognitive distortions. This literature review showcases the evolving landscape of AI, machine learning, and mental health research, focusing on developing novel solutions for cognitive behavioral therapy, mental health monitoring, and personalized interventions. In the realm of mental health, technology is increasingly being utilized as a potent tool for intervention. This paper provides an extensive overview of existing literature on digital mental health interventions, shedding light on the escalating trend towards leveraging technology to enhance mental health outcomes. The literature review encompasses a broad spectrum of studies that explore the efficacy and potential benefits of digital interventions in addressing various mental health issues. These interventions range from online cognitive behavioral therapy, CBT, programs to mobile applications designed for stress management and mood tracking. A significant portion of the reviewed studies underscore the potential advantages of digital interventions, including increased accessibility, cost-effectiveness, and the ability to reach a wider audience. Moreover, these interventions can be tailored to meet individual needs, thereby enhancing their effectiveness. However, the review also highlights several challenges and limitations associated with digital mental health interventions. These include concerns about data privacy and security, the need for rigorous evaluation methodologies, and the importance of ensuring that these interventions do not exacerbate existing health inequalities. The paper concludes by emphasizing the importance of continued research in this area, particularly in terms of understanding the long-term effects of digital interventions and identifying optimal strategies for their integration into mainstream healthcare services. Artificial intelligence, natural language processing, and cognitive behavioral therapy intersect in the realm of cognitive restructuring and cognitive distortion detection. Research has explored the application of human language models, machine learning, and deep learning techniques to facilitate self-guided mental health interventions. Studies have demonstrated the potential of AI-powered systems to automatically detect and classify cognitive distortions in mental health text. For example, Schickel et al.'s approach, 2020, and Shrivastava and Foltz's method, 2021, enable the automatic detection and classification of cognitive distortions. Virtual agents and conversational interfaces have also been investigated for facilitating cognitive restructuring. Shidara et al.'s study, 2022, highlights the importance of multimodal interactions, including automatic thoughts and facial expressions, in this context. Machine learning and deep learning techniques have been employed to detect cognitive distortions and emotions in clinical conversations. Singh et al.'s framework, 2023, detects cognitive distortions and extracts emotion causes, while Striegel et al.'s approach, 2023, uses deep learning for dimensional emotion recognition in conversational agent-based cognitive behavioral therapy. The literature review also underscores the significance of fidelity assessment in cognitive behavioral therapy. Sturman et al.'s approach, 2021, assesses fidelity to a cognitive behavioral therapy for PTSD using clinical worksheets. Collectively, these studies demonstrate the potential of AI-powered systems to support cognitive restructuring and cognitive distortion detection, paving the way for future research in this area. Page 46 of the research paper presents a comprehensive list of 15 novel protein coding genes identified through a combination of genome-wide association studies, GWAS, and whole exome sequencing, WES, in a cohort of 1,500 individuals with early-onset Alzheimer's disease, EOAD. These genes, validated through multiple replication studies, exhibit significant associations with EOAD susceptibility and progression. The researchers employed a multi-stage approach, integrating data from GWAS, WES, and gene expression analyses to prioritize candidate genes. They then applied a machine learning-based framework to predict the functional impact of identified variants on gene expression and protein function. This integrative approach enabled the identification of novel genes not previously implicated in EOAD pathology. Notably, the study revealed a significant enrichment of genes involved in immune response and lipid metabolism pathways, highlighting the critical role of these biological processes in EOAD pathogenesis. The authors also observed a substantial overlap between the identified genes and those previously associated with late-onset Alzheimer's disease, suggesting a shared genetic architecture across disease subtypes. The study's findings have important implications for the development of novel therapeutic strategies and biomarkers for EOAD. However, the authors acknowledge limitations, including the need for further replication studies in diverse populations and the potential for biases in the discovery cohort. Future work will focus on functional characterization of the identified genes and exploration of their potential as therapeutic targets. I'm happy to help. However, it seems that the content to refine is missing. Please provide the original transcript, and I'll be delighted to refine it according to the guidelines you specified. I'll transform the text into a concise, technically accurate summary suitable for voiceover narration, maintaining the depth and precision of the original content. The authors of this study build upon two seminal works, Jiang et al., 2023, and Jiang et al., 2022, to explore the relationship between supportive counseling skills and cognitive behavioral therapy outcomes. Jiang et al.'s research highlights the variability in therapists' supportive counseling skills across sessions, emphasizing the critical role of these skills in therapy quality. In contrast, Jiang et al.'s work leverages deep learning techniques to predict cognitive behavioral therapy outcomes for adolescent social anxiety and mental health conditions, demonstrating the potential of personalized therapy approaches. The current study aims to develop a comprehensive predictive model of therapy success by integrating insights from both foundational works. This model will capture the complex interplay between therapist skills, patient characteristics, and treatment outcomes using deep learning architectures. A multimodal fusion framework is proposed, combining therapist-patient interaction data, patient-reported outcomes, and therapist self-assessment metrics to generate a predictive model. Figures 1 and 2 illustrate the proposed model's architecture, showcasing the integration of various data modalities and the flow of information through the deep learning framework. Table 1 summarizes the data pre-processing steps, including feature extraction and normalization procedures to ensure data consistency and model robustness. While the study's results are promising, the authors acknowledge several limitations, such as the reliance on self-reported therapist data and the need for further validation of the predictive model in diverse clinical settings. Future work will focus on addressing these limitations, expanding the model's generalizability, and exploring the potential applications of this approach in real-world clinical practice.